So now we're going to experience the muscles of the hip. So first off, remember we're going to look at all the tissues around it, the front, the back, the abductors, the adductors, and the rotators. And we'll start with the hip flexors to begin with. So remember we talked about the iliopsoas going from the kind of front sides of the spine down to the lesser trochanter, and the iliacus going from the iliac fossa down to the lesser trochanter. So an easy way to palpate this here is just to first, we'll palpate the iliacus first. So we're just going to find the ASIS, remember the frontal hip bones, and go just medial to that. Now you can be seated in a chair or seated on the floor. And you're just going to take the legs out in front of you here, and you can do one or both legs. But you want to be doing the leg on the same side that you're palpating with your hand. And I'm going to push in pretty firmly now with my hands. I'm pushing in and pulling back. So I'm trying to palpate straight back into, remember, that iliac fossa, which is the front of the ilium. So I'm kind of curling my fingers around the ASIS to push back in toward the ilium. And I just want to relax my abdominals so that I can do that. So relaxing the belly as much as you can. I'm going to keep some pressure there, pressing back toward the pelvic bone. And I'm just going to lift my leg up there. And I can rotate and feel it as I externally rotate, as well as I relax and then lift. And you can do both one at a time there, feeling them contract on each side. I think it's helpful to kind of go back and forth so you can feel them contract and relax, and then play with a little bit of that rotation again. We talked about them also being a little bit of an external rotator as well. So now to palpate the psoas, we're going to have to dig in pretty firmly here. But what I'm going to do is, if you can imagine the rectus abdominis going down the front of the abdomen, which we'll look at later, I'm going to kind of go right off to the side of that, grab around my waist, and again, my fingers are going to point back in toward my spine. So I'm just going to round my spine and let my belly relax here. So I'm going to dig into this kind of soft abdominal mass as I relax the abdomen. The key here is that you really want to try and relax the abdominals. So rounding the spine will help, but also just kind of thinking, and if you need to take a couple deep breaths, thinking that in order to palpate the psoas, which is on the front of the spine, it's going to be deep not only to the abdominal wall, but also mostly the intestines, the abdominal organs here. So I really just want to try and relax. So kind of going around the sides of the rectus abdominis. I'm going to push back and in toward my spine. And then I'm going to lift one leg at a time. So I'm starting here kind of about like just a little bit below my belly button height. I could even go a little bit lower, and you'll start to feel this band. You'll feel the psoas, the band of the psoas coming down toward the hip. So it's going to go in this kind of orientation. And I'll feel a little band here. As I get closer up toward the belly button, it's going to move in more toward the spine, so it's a little less obvious to palpate. So if you lift the leg and lower on one side, again, you can rotate, but most of what you're going to feel is just the lifting of the leg. Now that's helpful just so you can feel where it is. I think as a teacher, it's helpful not only to feel it in your own body, but also with your fingers to be able to palpate and actually see just how deep this muscle is in the abdomen. So in order to palpate the psoas, we literally have to take off the abdominal wall, spill out the organs in order to get to the psoas, which clearly we wouldn't want to do, but we have to be able to palpate past all of that. So for this next one, you can take either your myofascial balls or some tennis balls. Either one will work. And we're going to place these under the abdomen. So here's my belly button. I'm going to go about 1 inch lateral and a little bit inferior. So I'm going to place the tennis balls and the myofascial balls just here, slightly below the belly button, with about 1 inch or 2 between them. So I'm going to lie on my belly, and I'm going to take the balls underneath me. So I'm going to position the myofascial balls so that, again, they're about 1 inch apart, slightly below the belly button. And then the first thing I want to do here is just try and relax. So I'm going to lie down and start by just taking a few deep breaths. So trying to relax the abdominal wall so that as you do this, you're closing your eyes and visualizing the abdominal wall softening here so that the tennis balls or the myofascial balls can start to sink in through the abdomen here, heading toward the spine. So as you inhale, press the belly out into your myofascial balls there, into the tennis balls. And as you exhale, imagine them sinking deeper into your belly as you just allow the body to be heavy. Now the aorta is close by, so you might also feel the pulsing of the aorta. If it's uncomfortable, you can move the myofascial balls just a little bit lateral to where they are. And then from there, if you're comfortable, you can come up onto the forearms. So clearly, again, this isn't meant to be painful, so back off anything that's uncomfortable or painful. But if you're comfortable there, what you're going to do here is try and relax. So don't think about your yoga alignment, but try and relax the belly so that those tennis balls or myofascial balls sink into the belly. So I'm really trying to soften the abdominal wall to allow them to get close to my psoas. Now, as you close your eyes, I want you to visualize that layer of the psoas attaching to the transverse processes, the vertebral bodies, and the discs, right around the side of the vertebra and the front of the vertebra, so that you're deep to all of the contents of the abdomen. Now, if you can visualize that and you're comfortable there still, you can flex your toes. Try and keep the belly soft as you lift the quadriceps and the knees, and you should feel a little bit more awareness around that psoas. Again, part of this is just feeling the approximate area with which the psoas is going to run through. So from the spine through the front of the hip to the upper inner thigh. Okay, then release. And this time, I'm going to lift up. You don't need to move there. This time, you're going to move the tennis balls so that they're right inside of your ASIS. So here's my ASIS. I'm just medial so that it's almost grazing the edge of my ASIS. So I'm going to lay down again, place them inside the ASIS. And for this one, I'm going to start on my belly again and try and relax. Take a couple of deep breaths, trying to soften the superficial abdominal wall. Later, we'll look at the obliques here, and some of the attachment of the obliques is in this area, so I am trying to soften that. And then if you're able to relax there, you can either stay there or come up onto your elbows. So what we're trying to get here is for you to be able to feel a sensation on the iliacus, remember, covering the front of the ilium, the iliac fossa. So remember the Dumbo ears of the pelvis, so the iliac crest here, creating the back of the pelvis. We're on the front side of that. So I'm trying to relax the abdominals, and what you should feel is kind of like a dull, achy awareness or sensation in that iliacus. And again, our purpose isn't so much to do myofascial release or to work on the muscles specifically, though that might be a nice side effect, but to help you feel and experience the muscles. So as you close your eyes there, see if you can bring your awareness into that iliacus, that broad origin around the front of the ilium. And that awareness of the pressure of the tennis ball, gently compressing the tissue here to give you a nice awareness of how deep in the pelvis, more in the back half of the body, but situated on the front side of the pelvis. Good, and then just release. You can come down onto your belly or remove them first, and then just make your way onto your back. So you can lie on your back either with your knees bent or straight, but just take a moment there, close your eyes, and just feel, because part of it is what you're feeling during, but you'll also feel a little bit of awareness in the musculature of the psoas and the iliacus afterwards as well. And you don't need to overthink it, but just to notice that awareness. And then we're going to move into the antagonist, the gluteus maximus. So you want to have your myofascial balls close by, place your feet on the floor, and you're going to lift your hips up. Now, I'm going to place the balls underneath me, and you can stay there as you watch this. I'm going to place them on the outer edges of the sacrum. So here's the triangular bone of my sacrum, and I'm going to be just lateral to the top part of the sacrum, and I'll be moving down just a little bit along the edges, the outer edges of the sacrum here. So we're going to the attachment of gluteus maximus, that area that tends to get tight, and that clenching we looked at earlier. So again, I'm right at the outer border of the top of the sacrum. And I'm just going to pause there, walk my feet a little wider, and rest my knees together. And though for most people it usually feels like a nice, gentle release here, it's not usually the most intense of the ones that we look at, there is kind of a nice release around this area that tends to get tight. So I'm just letting gravity press into it as I close my eyes and visualize this attachment of the gluteus maximus, this large, powerful muscle that originates around that PSIS, which we're slightly below now, and along the outer edge of the sacrum, which is where we are now. Now, if you want to, you can also roll down a little bit. In fact, if you feel really comfortable there, you can come up onto your elbows and just rock a little up and down, rolling along that origin, along the lateral part of the sacrum. And if the balls start to roll away, you can just move them back in so that, again, they're right on the outer edge of the sacrum. And you can feel how tight and kind of fibrous that area can get as you roll up toward the PSIS and down along the edges of the sacrum. They tend to want to roll away as you do that too. So you might have to move them around a couple times. You can feel that tendency to clench and grip and create tension in this, really this upper portion of the gluteus maximus. Great. Then lower down. Take a moment just to release and close your eyes and feel, even just in a couple minutes. Clearly, we could do this a little bit longer and feel more release, but even just in a couple of minutes, or not even minutes, but moments, the effect in this area that tends to get tight. Great, then open your eyes and roll over to your side and press up for a moment. We're going to come up to stand for a moment for this next one. Gluteus medius, I want you to palpate it, and then we'll do a little bit of myofascial for it too, so you can feel it in a couple different contexts, active and passive. But you're going to come up to stand for this first one and take your hands on your waist. Remember that it's going to originate from just below the top of the iliac crest. So if you hook your fingers on the top of the iliac crest, you want to go an inch or two below that, so that I'm just slightly on the posterior part of the hip. So you can see how my thumb kind of wraps around the back of the hip, but not all the way to the posterior part. So if I take the V of my hand right onto the side of my hip, my thumb will kind of land right back on the gluteus medius. And this whole area here is going to be my gluteus medius versus this more posterior being my gluteus maximus. And there's a little bit of an overlap between them. But here's the medius. I'm going to plant my fingers here, and I'm going to press pretty firmly so that I can see if I'm in the right area. All I'm going to do is just slowly start to march in place. And as I stand on my right side, I should feel the right side gluteus medius engaging to draw the hip into the socket. So as I lift my right leg and stand on my left leg, I'm again going to feel the left hip hug into the socket. So I should be feeling the standing leg as the activating side on the gluteus medius. Now, as you continue, you can take your fingertips as you continue to march in place and just palpate around to see how large this muscle is. You can feel it kind of this whole slightly posterior lateral part of the hip and make an outline of the shape of it all the way down to the greater trochanter, which we were palpating before as kind of the widest part of the hip. Great. So now that you know approximately where you're going, you're going to take one of these guys here. In fact, we'll start with two just to get you in the right area, but we'll mostly be using one. You're going to lie on your back, and we're going to start with these where we began, so just lateral to the upper portion of the sacrum. Then from there, you're going to move 1 inch lateral. So here's where I started before, just lateral to the sacrum. I'm going to go 1 inch lateral from there. So just lateral to the sacrum, 1 inch further. So just lateral, 1 inch further, and then I'm going to straighten my right leg, and I'm going to start to roll over to the right side. Now, we're going to kind of work in this whole general area. So I'm going to start to roll onto my right side and just start to rock front to back. Now, remember that the muscle fiber orientation is going to be more up and down along that gluteus medius. So I'm going to be kind of cross fibering so that I can feel that distinction of the muscle fibers of the gluteus medius. Now, I can go all the way over here. And since we're not really staying and trying to release and relax, we're going to kind of be moving around to feel out the tissue. You can play with how you support yourself. You could even come up onto the elbow and see if you can rock a little side to side. And maybe find one spot that you can just stay with here. So notice you can't see my myofascial ball because it is slightly more posterior. If it were right here, I'd be more on the TFL. Right where you can see it. So notice that it's either straight on the side of my body or slightly behind me. So that I am on that gluteus medius. And I'm visualizing that the ball is just slightly below the iliac crest, an inch or two inferior to the iliac crest. So as you continue, roll around there, you could have it anywhere in this whole area here. So we're just kind of searching, and what you'll find is that there's probably several areas that stand out as being tender here. You're welcome just to stay there for a moment. In fact, what you might feel is a dull, achy sensation, not just in that area, but down into the hip joint, maybe even down the leg. Remember, none of this should be painful or sharp or shooting, but more of an achy awareness. So I just want you to take enough time that you can kind of outline the tissue of the gluteus medius going kind of all the way down, almost to the hip, and all the way up until you're right below the iliac crest, going back a little bit, and forward until you're kind of like right on the side of the hip. That whole area here, and then if you want to kind of move around within that, if you feel like that's comfortable to coordinate that there. Just take another moment, find one spot that you can just relax for a moment. And then lie on your back just so that you can feel the difference between the two sides. These muscles we talked about are really important stabilizers of the hips, and I find just taking this moment, even just after a minute of that release, to really feel the difference between the two sides, how much work these stabilizers do and how helpful it can be just to release them, whether that's in a yoga setting or stretching or myofascial release, to invigorate the tissues that work so hard here. Such important stabilizers that we use throughout our day when we're standing. And then just so that we're even, we'll do the other side. This side should be a little bit more familiar to you. So again, you'll take it underneath the hip, just lateral to the top of the sacrum, and then start to roll over just a little bit to your left. So I'm using my right leg to support me, and I can just rock a little bit forward and back. Again, visualizing the fibers of the gluteus medius running up and down so that I'm rocking my hips forward and backward, kind of cross-fibering the tissues here. Now, there's no right or wrong way to do this, so don't worry about being in exactly the spot that I'm talking about. But remember, the biggest thing is you just want to be in that kind of general area of the gluteus medius. So you can continue there as I just show you really quickly. Again, this whole area in through here. So slightly posterior and also lateral on the hip. So I can roll all the way almost down to the greater trochanter here and all the way up to this ridge right underneath the iliac crest. So we're starting more in through here. As we roll more into the side, we'll be more in through here. So as you continue there, you can start to roll a little bit more to the left. Make sure that the myofascial ball stays right underneath you there. You can either stay on the ground here or come up onto your elbow. So you're just trying to make yourself comfortable so that you can really pay attention more to what you're feeling as you outline the tissues, as you kind of get an experience and a taste for what each of the qualities of the tissues of the anatomy feel like in your body. So again, remember, I can roll up or down, and I can go kind of all the way down I'm all the way down here at the hip joint. I know you can't see it very well, but the myofascial ball is about this height. So right about the height of my hip joint. Here's my pubic bone, so I'm slightly above that. And there you can see it popping out behind my pocket. As I roll a little more to the back side of gluteus medius and a little bit more straight onto the side here. Now I'm staying away from that pocket zone. TFL, we'll look at that later, but it's going to be a little bit more to the front. We'll look at that next. And just find a spot there you can stay with if you want to. Again, you can cross fiber it a little bit or just be still. And as you close your eyes there, again, try to visualize the outline of gluteus medius going from right below the iliac crest down this slightly posterior lateral side of the hip to the very kind of top side of the greater trochanter. And just take a moment to notice the sensations there down into the hip, maybe even a little in the leg or the pelvis. And then remove the myofascial ball and lie onto your back. I'm going to take a moment, just as in our yoga practice, part of what we're trying to feel is not just the experience during, but also the awareness after. So that you can visualize both sides now, the gluteus medius sitting on the sides of the hip as an important stabilizer and an abductor, to draw the head of the femur into the socket, into the acetabulum, creating that cohesion and support. Now, coming up to a seat, the next one we're going to do is the TFL. So we palpated this one really briefly earlier, but I just want you to come back to it. Remember, this is our pocket muscle. So if you find the ASIS, and I draw a line out to the IT band on the lateral thigh here, that's the approximate area we're going to be in. So sometimes it correlates to the pant pocket, sometimes approximately. But what I want to do is draw that line and then put my finger maybe somewhere in the middle of it. So here's my line from ASIS to IT band. I'm going to put my finger somewhere in the middle-ish. And I'll know when I'm in the right spot as I come into this. My legs out in front of me. I'm going to start to fold forward into Paschimottanasana as I draw my legs into internal rotation and press my feet toward each other. So remember, this is a hip flexor, an internal rotator, and an adductor. So I internally rotate and adduct as I push my feet together. And usually I don't have to do that very hard. You can feel it contract. And then as you relax and let the feet turn out and then contract, you'll feel it soften and engage. So you can really start to feel it and palpate with your fingers. You don't need to be able to go deep into your forward fold here, but palpate with your fingers so you can draw a line along the TFL and feel it attaching to the IT band. So for me, mine was right where the line that I started with, right in through here. Great, now that you're familiar with it, we'll get a new experience of it. Probably give you a different awareness of it. We'll just need one of the myofascial balls or tennis balls. And I'm going to place this in that pocket zone. So I'm going to take that and I'm just going to think about it being right in the center of that pocket zone, just where I was before. And I'm going to roll a little bit onto my front side now. So I'm not straight onto the floor. I'm not straight on my side, but I'm kind of halfway in between. So I've got the knee on the floor in front of me to support me, and I want to make sure that that myofascial ball is right in that pocket zone still. Make sure that the ball is right underneath you as well. Now, if you're not feeling very much, the TFL usually is a tender area for most people. So if you're not feeling very much, try rolling a little up or down, or even a little forward or back, because usually you'll know when you've got it. This is one of those that's kind of like an all or nothing. And if you just move a little bit in one direction, you can usually feel a very different sensation. So I want you to just take a moment, find an area that's a little bit tender there. Again, it shouldn't be painful. But find something that's tender and then see if you can just stay. So support yourself however you need to there. You can even grab, we won't be here long, but you could even support yourself with a block. And then close your eyes and see if you can connect to the sensation of the TFL here, going from right below that ASIS, that frontal hip bone, to that lateral side of the thigh to connect to the IT band, creating those puppet strings that can pull on the IT band to help coordinate and stabilize the hip and the knee. Great, and again, we could stay longer, but that's enough for now. Lie on your back, take a moment, and feel the difference between the two sides so that you can really start to understand the experience of this muscle as you play with this release, especially between the two sides. Once you've done one side and not the other, feeling the difference. Maybe even of how your leg sits. Maybe one leg feels like it turns out more than the other, or heavier. You don't need to overthink it, but just notice the difference. So that without having to really specifically overly analyze it, we're paying attention to how the muscles are like puppet strings, pulling on the structure and the bony structure of the body to orient us and position us. So come on up now that you've got that. We'll do the other side. So again, find that pocket zone. So if you need to come back to Paschimottanasana for a second and outline it, find the center of that pocket zone between the ASIS and the IT band. And that's where I'm going to want to place that myofascial ball. So again, you can kind of test it there and then try and keep it in place as you roll over onto your side and place that right knee up on the floor in front of you. And again, find some support. So if you want to block there, you can support yourself. Otherwise, just the elbow will work. And remember that if you're not feeling very much, you're probably not in the right area here. There should be a little bit of tenderness on this guy. At least in my experience over the years with students, it's rare to find someone who feels nothing here once they're in the right spot. So again, if you're not feeling much, roll a little up or down, or even front to back. Even just half a centimeter sometimes can make a very different awareness and experience there. So once you find an area that's a little tender, close your eyes. See if you can relax a little bit there, which might be tricky. Usually this one's quite a bit more tender than most people expect this kind of little hidden gem of an area to be. And part of the reason why this investigation is really helpful too, to just understand and really feel from an experiential perspective the quality and the texture of the tissues, these stabilizing hip muscles that work so hard so much of our day. And then again, we won't stay there very long, but just remove what's underneath you and come to lie on your back again for a moment. And take a moment there. You still got a lot of that sensation probably in the hips, probably a nice rejuvenated sensation in comparison to the tenderness. Notice the difference between the two sides, and maybe it feels more symmetrical now. Maybe not, no expectations, but just notice. The positioning of the feet, how they turn out, the heaviness of the legs, the pelvis. Noticing how these puppet strings of the TFL pull on that IT band to position both the hip and the leg. Good, then roll onto your side or press up. For this next one, I want to take a moment just to outline where the adductors are going to be. So when we look at the thigh, we'll look at the hamstrings and the quadriceps later, but the adductors are going to be just this thin patch of skin. Remember, their strength is in how deep they go to get to the bone, to get to the femur here. So if I contract my quadriceps, and I'm just going to palpate the medial one so that I can feel where the adductors are, I'm going to feel the edge as I flex my foot and extend my knee. I'm going to feel my quadriceps engage here. So I'm palpating for the medial border of that. I'm going to keep my fingers there. Now I'm going to find my hamstrings. I'm going to push my heel into the floor, engage my hamstrings, and again, find where the hamstrings end here. So you can see on me, here's the end of my hamstrings. Here's the end of my quadriceps. This little patch in between is going to be where the adductors are going to run. So again, you can see it doesn't cover a lot of surface area, but because I know here's my femur, right, it's going to go all the way from the skin down into the bone. The strength is coming from that depth. So just noting, and a lot of times that adductor is going to be right on the seam of your pants there. If you've got a seam on the inner part of your pants, it's usually about the same place as that inner seam. So we're going to grab one. You might want a block for your head as well, but at least one block. Grab one of the myofascial balls, and you're going to rest on, I'm going to rest on my right side. So you can follow me into this with the left leg coming onto the block here. So again, I want to find that inner seam, and I could just start somewhere in the middle here. So I'm going to be right in the center, right in the muscle belly of the adductors there. And I'm just going to rock up and down so I'm cross-fibering. Remember, the muscle fiber orientation is going in this direction. So I'm going to rock over it front to back so that I can feel the tissue of the adductors running in between there. And then you can move it up a little bit, finding just a little tender spot there. Again, trying to stay right on that inner seam of the leg. And you can even move it up a little higher. So now I'm pretty close to this upper portion of the adductors, and usually it gets a little more tender there. So I'm going to rock the leg up and down, and then I can just find one spot to stay in here. Now, if this is too much, you can either skip it or place another block or prop, or even just rolling up a blanket to hold up your leg so it's not as intense, because this one can be a little bit tender. But if you're comfortable there, you can let the leg rest, close your eyes, and then visualize the origin of the adductors. Remember, coming from the pubic bone all the way back to the sitting bone, and inserting along the shaft of the femur with just one of them crossing the medial knee. And just find one more spot. So you can rock forward and back a little bit now. Instead of cross-fibering it, I'm rocking up along the attachment of the adductors here, just so I can kind of paint this awareness of the adductors running up through the inner seam of the thigh. Great. And for your own benefit, you could clearly stay on any of those if you wanted to. But for our purposes of learning the anatomy, we're just going to come on out of it, take a moment to feel that change from one side to the other. And this is one of the reasons why I really like the myofascial release for learning the anatomy, is that it really releases the tissues very quickly. It's not always long lasting, but it releases the tissues really quickly so you can feel the effect that it has on the surrounding structures, on the opposite hip, on the rest of the body, and how these muscles pull like puppet strings to influence the entire system. So we'll just turn on over to the other side. Grab the blocks, flip on over. And again, we'll start. So we're starting here, again, the inner seam. We're working that all the way up here into this general area. So I'm going to start in the middle of the adductors. And I'm going to rock my knee up and down. So I'm cross-fibering. Remember, the adductors are running in this orientation, and I'm rocking across it with the myofascial ball underneath it. And there's a lot of information around the how and why behind the myofascial that we won't get into. But really what we want to do is just be able to isolate and feel that kind of ropey muscular structure that we're rocking over, so that we can build a connection and awareness of the muscles here. So I'm just going to move it up. And I'm going to rock again. And I'm feeling this strap of musculature running up this inner thigh, inner seam, as I continue up a little bit higher. So this last one is pretty close to the groin. And you can even roll forward a little bit here, decide how much pressure you want to put into it. But again, I'm right on that inner seam, and you should kind of feel, especially if the muscles are really tight, you're going to feel like you're kind of plucking over the muscles back and forth. And then if you want to, you can even rock a little forward and back as long as you're staying on the block. And find a spot that you can just stay with for a moment and relax. Visualizing that origin around the pubic bone back to the ischial tuberosity. And this group of muscles going down to insert on the femur. Powerful in their strength and numbers and their depth. And supporting and working with the abductors to position the femur, the head of the femur in the socket, as well as to coordinate the positioning of the knee. Great, release, lie on your back again. And take a moment with your knees bent or straight, again, just to check in and notice, now that you've done both sides, this tension system in the body and how it's influenced really by everything we do, the patterns we take, the postures we take in our practice, the postures we take in our life. And then you could just look up here at me, look on your screen for some guidance. I'll talk you through this next one. You'll be on your back. We're going to use 2 of the myofascial balls. And we're going to take them, if you were to imagine each butt cheek, each glute, or glute, as we mentioned before, is a very vague term. It doesn't really tell us a lot of anything because there's a couple of different ones. But imagine the whole cheek here as a circle. And I want to think of the bullseye right in the center of that. That bullseye is going to be about in the center of the piriformis. Remember, the piriformis is going to go from kind of the lateral surface of the sacrum out to the greater trochanter. And clearly it's deep, so it's not going to be as big as it looks here because it's going to be deep to the joint. But I'm going to be right in that bullseye here, right in the center of it is where I want to place the tennis balls and the myofascial balls. So I'm going to lie on my back. I'm going to bend my knees and place my feet on the ground, and I'm going to lift my hips just enough that I can place the myofascial balls or tennis balls in that bullseye. So I want to make sure they're right in that spot. And if you come into some of these variations and you're not feeling very much, you might just play with the position. You can roll a little up or down or move them a little wider or closer. But you should be approximately in that bullseye. You've got a little leeway there. So for this one, we're going to kind of focus on one side at a time, but first let's just feel them both together. So you're going to take your feet and walk them a little wider than your hips and let your knees rest in toward each other. Now already you might be feeling a lot. Maybe you're feeling more on one side than the other. Make sure they're symmetrically placed. And sometimes it might just be that one side is tighter than the other. But take a moment just to feel, as you draw the knees in toward the midline, a little bit of that tension, a little bit of that awareness in the piriformis, that deep layer in the posterior part of the hip. And so you can stay there if you want, otherwise we're going to work a little deeper on one side at a time. So if you're already feeling a lot of sensation, just stay. Otherwise, you're going to take the right ankle to the left knee. And again, that might be enough already. Or if you want a little bit more, you can kind of rock the hip side to side. So we're just looking for an area that's a little bit tender. There's a little bit of a masochistic nature to the myofascial release for a good cause in the end. It shouldn't be painful for no reason, and it shouldn't be painful in general. So what we're looking for is a little tender area. You can stop anywhere where you start to feel that. That might be leaning the hips over a little to the side. It might be just staying upright here. it might be in the first variation with the knees toward each other. But close your eyes as we focus a little bit more on the right side now, if the leg's lifted. And visualize that piriformis on the right side going from the lateral part of the sacrum to attach to the posterior part of the greater trochanter. And maybe even visualizing, remembering what we looked at with Fred, the effect that has on our ability to externally rotate when we're standing. And that stretching that happens as we bend forward into our hip openers. And just taking a moment to feel the quality of these tissues that we talked about that tend to get a little tight, tend to grip and clench sometimes with the gluteus maximus. And then we'll just come back to center and switch sides. So make sure that the tennis balls or myofascial balls are right in the bullseye. And then if you're doing one side at a time, take the left ankle to the right knee. And again, if you want, you can kind of sway the hips side to side. And find a spot you can just relax into there. Close your eyes and visualize the piriformis running from the sacrum to the greater trochanter. Also an important stabilizer for the pelvis, the hip, the SI joint, but one that tends to get a little bit tight. Seeing if you can just use that awareness to soften a little and to experience and feel where that piriformis is deep in the posterior part of the hip, that deepest layer. And then slowly release and straighten or bend the legs and take a moment there, again, just to notice. Feel the effect not just on the hips, but on the rest of the body. As you notice the effect of just releasing the piriformis. So you can start to feel how each of these muscles really kind of has a personality of its own. Each one of them has very different experiences and sensations, which can clearly vary from one person to another, but also vary from one muscle to another. And as a yoga practitioner, one of the things that I think is really helpful is just familiarizing yourself not only with the brainy understanding of the anatomy, but also with the experience of what you feel in your body, as well as in your practice, which is where we'll go next.